Good morning, students. Today I will discuss one strongest and largest facial bone, and that bone is the mandible. Second largest bone of the face is the maxilla. This mandible is the only bone of the face which is movable. Other facial bones are immovable. Let's see what are the parts of this bone, and then at the end I will show you how to hold the bone in anatomical position. This bone having mainly two parts. One is the body. This part is the body, which is horseshoe shaped, and second part is the ramus. This part is the ramus. If you see the side view, this part is the ramus. And I will discuss first the body, its different anatomical features, then I will come to the ramus. In the body, there are two surfaces. One is the external surface or outer surface, which is convex. If you see from this side, yes, this is the outer surface or external surface, and opposite to it, this concave surface is the internal surface. And one upper border or alveolar border or alveolar process, and one lower border. This one is the lower border. It is called the base. So two surfaces and two borders. This is the external surface. This one. Here in the midline there is a ridge here. This is called symphysis menti. So symphysis menti, it is the union between the two halves of the mandible. Before birth, the mandible is having two parts, right and left half, and they are united by fibrous tissue in the midline. But after birth, within 1 to 2 years, these two halves they united and forms the symphysis menti. But the term symphysis, it is a misnomer because it is unlike the symphysial joint, it is united by the fibrous tissue, not by the cartilage like that of the symphysial joint. So though the name is symphysis menti, it is not actually symphysial joint. Now it is united by bones. The symphysis menti, if you trace it downwards, it forms a triangular elevation here. This one. Apex, it is merging with the symphysis menti, and below this elevation is called the mental protuberance. And on each side of this mental protuberance, the small elevation is called mental tubercle. So the mental tubercle and this mental protuberance together called the chin. Then what we can see are other features on the external surface. One line extending from the mental tubercle upwards, here upwards and backwards across the surface, but below the mental foramen. This is the mental foramen, below the mental foramen, and it is continued upwards and backwards along the anterior margin or anterior border of the ramus. This is called oblique line. And this foramen is called, it is mental foramen. It is in the adult halfway between the upper border and lower border. But at younger age, this foramen is close to the lower border, but in old age, this foramen, it is close to the upper border. And these structures passing through the mental foramen is the mental vessels and nerve. And this mental nerve, it is a sensory nerve, and it is a continuation of the inferior alveolar nerve, I will tell you. And this sensory nerve, it supplies the skin at the region of the chin, including the skin of the lower jaw. And sometimes the examiner may confuse you, this mental nerve supplies which muscle? The mental nerve supplies the mentalis muscle, but it is completely wrong, because mentalis muscle, it is a muscle of the face and it is supplied by the branch from the facial nerve, marginal mandibular branch of the facial nerve. So it is a motor supply, but here the mental nerve, it is a branch from the inferior alveolar nerve, which is sensory nerve. So this sensory nerve supplies the sensation or skin, not the muscle. This is inner surface, which is concave. And here also you can see one line, very prominent line here. Outside this line, oblique line, here it is oblique line, but here this line is called the myelohyoid line. So myelohyoid line, it extends from a point 1 centimeter from the alveolar border here, behind this is third molar tooth, this one, so behind the third molar tooth, and then up to the symphysis menti, it is going forward. So this is the myelohyoid line where you will get the attachment on important muscle, that is myelohyoid muscle. And the nerve supply of myelohyoid muscle, it is nerve to myelohyoid, which is a motor branch from the inferior alveolar nerve. So inferior alveolar nerve having sensory part which enters into this mandibular foramen here. And the motor part, it runs along this groove below the myelohyoid line, is called myelohyoid groove. So myelohyoid groove here lodges the myelohyoid nerve which supplies the myelohyoid muscle which is attached along this myelohyoid line, this one. And if you go more medially, here you will see there are 4 small tubercles, 2 upper and 2 lower. All these 4 tubercles are called genial tubercle. Upper to genial tubercle, lower to genial tubercle. The upper to genial tubercle, here you will get the attachment of one muscle, that is genioglossus. Genial tubercle to tongue. Genioglossus, which is the safety muscle of the tongue, supplied by hypoglossal nerve, and below these 2 genial tubercle, here you will get the attachment of another muscle called geniohyoid, which is supplied by the C1 nerve, which is passing along the hypoglossal nerve. And sometimes you may get the one foramen above the genial tubercle called genial foramen. If I show you another mandible, here you can see this prominent genial tubercle, 2 upper and 2 lower, and here is a small foramen. This is called genial foramen. What are the structures passing through the genial foramen? The structures passing through some blood vessels which supplies the symphysis menti here, or this region. Below this genial tubercle, here this red mark is there. These 2 are small depression. In this bone, this green area, this depression called digastric fossa. In the digastric fossa, one muscle is attached. This muscle is the anterior belly of digastric, which is again supplied by the same nerve, that is nerve to myelohyoid, supplying the myelohyoid muscle, and also continued as a nerve to supply the anterior belly of digastric. In this connection, if you are asked what is the nerve supply of posterior belly of digastric, the answer will be it is a facial nerve which supplies the posterior belly. So anterior belly by the nerve to myelohyoid, which is a branch from the inferior alveolar, which is a branch of the mandibular nerve. But the posterior belly of digastric, which is attached in the mastoid process of the temporal bone, and it is supplied by the facial nerve. You see, this is myelohyoid line, this is myelohyoid groove, and this fossa you will get above this line. This smooth triangular fossa is sublingual fossa. Here the structure is the sublingual salivary gland, and below this line another fossa is there. This fossa lodges the submandibular salivary gland. Next part of the mandible is the ramus. This is ramus of this side and ramus of this side. It is quadrilateral in shape, having 4 borders. If I hold it in this way, this is anterior border, this is posterior border, this is upper border, having a notch called mandibular notch, and lower border. So the lower border here, it is continuous with the base of the body or lower border of the body. So at one point, the lower border of the body becomes the inferior border of the ramus. Then what is the line of demarcation between the ramus and the body? If I draw a line at the junction, it is an imaginary vertical line extending from the alveolar process behind the third molar. This is third molar tooth, This is thermolar tooth of this side. From there, if you draw a vertical line, imaginary line of course, downwards, vertically downwards, like this, up to the lower border here. So this is the line of demarcation between the body and the ramus. So this part is a ramus now. And this inferior border, it meets at an angle with the posterior border here. It is called angle of the mandible. It is a very common mistake of the students. If you are asked, show the angle of the mandible, everybody can show this is the angle of the mandible. Then the question is asked, how this angle is formed? Most of the students answer that this angle is formed by the posterior border of the ramus and inferior border of the body or base of the mandible. But actually, the base or the body does not take part in the formation of the angle. The angle is found only by the ramus, that is posterior border and inferior border of the ramus. So angle is a part of the ramus, not in any way it is found by the base or body of the mandible. Sometimes it is asked, by this point angle, can you identify it is a male or female mandible? The point is that in this particular mandible it is everted. This angle is everted in both sides. And if I show you another mandible here, this is inverted. Can you differentiate? This inverted means inward turning in this mandible, but here it is outward turning. So outward turning or everted angle means it is a male mandible and it is a female mandible. And other points are also there, like this one, this curvature, it is more or less square shaped in case of male and round, it is continuous round shaped in case of female. This is another point. So you remember at least 2 points. One, the everted and inverted angle of the mandible and the anterior surface of the body of the mandible in the midline, whether it is square shaped or it is round shaped. Square means male, round means female, this curvature. Then what are the other features of the ramus? This is external surface or outer surface, this is internal surface. On the external surface, in the posterior and inferior part, larger part, here there is an attachment of a muscle, which is one of the important muscle of mastication, and that muscle is the masseter. On the inner side and the posterior inferior part, here you will get another muscle, that muscle is the medial pterygoid. Here you can see one foramen. This foramen is called the mandibular foramen. Structure of the mandibular foramen. The structure is the inferior alveolar vessels and nerve. The sensory part of the inferior alveolar nerve passes through this foramen into the canal inside called the mandibular canal. But the motor part, it runs through the mylohyoid groove along with the mandibular vessels. So the inferior alveolar nerve, while it is passing through the mandibular canal, it gives sensory supply to the different teeth, and ultimately the nerve comes out to the anterior surface to this foramen called mental foramen as the mental nerve. I already told you. And here is a bony projection anteromedial to this foramen. This bony projection here, this one, and this may be prominent in other mandible also, this projection anteromedial to this foramen. This is called this one, lingula. This lingula having one important ligament attachment, and that ligament is the sphenomandibular ligament, and the upper attachment of this ligament is the spine of the sphenoid. From there, here is the lower attachment of the sphenomandibular ligament. Then come to the upper border. The upper border also called mandibular notch. What are the structures passing through this notch? Very common question. The answer is mesenteric vessels and nerve. For mesenteric artery, they are the branches from the second part of maxillary artery, and mesenteric nerve, the branches from the anterior division of mandibular nerve. So the nerve passing in this way and supply the masseter outside. Here is the masseter muscle. So the structure passing in this way and supply the muscle. Masseteric vessels also passing here and to supply the masseter. So masseteric vessels and nerve here. And you can see two process from the upper end or upper side of these ramus. This is one process, this is another process. This process is called coronoid process and this process is called condylar process. The coronoid process, it is having two surfaces, one lateral surface, one medial surface, and it is the tip of the coronoid process. This is anterior border, this is posterior border. The anterior border, it is continuous with the oblique line on the anterior surface of the body, and the posterior border, it is continuous with the mandibular notch, and the medial surface and anterior border here, it gives attachment to another muscle of mastication called temporalis muscle. This part is called the condylar process. It is expanded head, this one, and below it is the neck. This condylar process of both sides, and this is ramus, form a angle. I am showing you how the angle is formed. It is a long axis of the condyle and it is a long axis of the ramus. So it forms more or less a right angle. If you see the condyle only, the dimension of condyle from side to side, it is about 2 centimeter, and anteroposterior dimension, it is about 1 centimeter. This condyle, it is not actually transversely aligned, it is obliquely aligned. That means the lateral end of this condyle, this one, it is to some extent slightly anterior to the medial pole, both sides. This is slightly anterior to this pole. So if you draw a line along the upper surface of the condyle, it looks like this. Here also on this side, it looks like this. So these two lines meet posteriorly here at an obtuse angle, and this angle measures about 145 to 160 degree, and this condyle, it articulates with the mandibular fossa in the temporal bone. You know, this is the mandibular fossa, here having two parts, anterior articular part and posterior non-articular part. This anterior articular part with the anterior tubercle, here this mandibular head or condyle articulates like this, forming temporomandibular joint here, this one. This joint, you know, it is a synovial joint which is divided by a articular disc into two compartments. Next part of the condyle is the neck. In the neck, anteriorly, this green area, here you will get a depression or fovea. It is called pterygoid fovea because the lateral pterygoid muscle is attached here, the pterygoid fovea. And around the neck, you will get the attachment of capsular ligament of temporomandibular joint, and besides this, on the lateral side, you will get another ligament called temporomandibular ligament. On the medial side of this neck, you will get one important nerve related to it, and that nerve is the auriculotemporal nerve. And also below the auriculotemporal nerve, you will get one artery. That artery is the first part of maxillary artery. And one important nerve, I forget to tell you, here you will get behind this alveolar arch, you will get another important nerve called lingual nerve. It is a sensory nerve present behind this. And here at the junction between the body and the lower border ramus, it is attachment of a masseter. Here you will get one artery and one vein, one nerve. The artery is the facial artery, vein is the facial vein, and nerve is the marginal mandibular nerve. So I told you all the four muscles of mastication. This is masseter, medial pterygoid, lateral pterygoid, and temporalis. If you are asked what are the muscles of mastication, these four are the muscles of mastication. In the mandible, whether they are inserted or their origins, Your answer will be all the four muscles of mastication, they are inserted into the mandible. No origin here. All the four muscles, they originated from the other bones, like the temporalis below the temporal line or temporal surface of the frontal bone and parietal bone, then masseter here from the zygomatic arch here, lateral pterygoid from the greater sphenoid and lateral pterygoid plate, and the medial pterygoid also from the medial surface of lateral pterygoid plate. That means all the four muscles of mastication, they are originated from the other bones, but all are inserted into the mandible. And on the lower border here, you'll get one attachment of deep fossa, investing layer of deep fossa, and here close to the molar tooth outside, you'll get one muscle attached, that is called the buccinator at the level of three molar tooth, and from inside, opposite to the third molar, you will get another muscle called superior constrictor, and behind this third molar tooth, between the buccinator in front and superior constrictor behind, there is one raphe called pterygomandibular raphe here. This angle, it is usually in adult 110 to 120 degree, but in newborn and in the old age, it is about 140 degree. Which ligament is attached to the angle here? One ligament is attached, that is the stylomandibular ligament, the upper end of which is attached to the styloid process of the temporal bone. And stylomandibular ligament is nothing but the thickened deep cervical fossa, investing layer of deep cervical fossa. And parotid gland, another one salivary gland, which is related to the posterior border of the ramus here. So we got three salivary glands related to the mandible, one parotid gland here close to the posterior border of the ramus, and in the sublingual fossa, sublingual salivary gland, and below the myloid line, submandibular fossa for the submandibular salivary gland. This mandible is the second bone to ossify in the body. First bone to ossify in the body is the clavicle. Clavicle starts ossification at about 5 to 6 weeks of intrauterine life, and mandible, it starts ossification about 6 weeks of intrauterine life. So it is a second bone to ossify next to clavicle. Then at last I will hold the bone in anatomical position. Now we know the anterior surface, posterior surface, ramus, upper margin having mandibular notch. So hold the bone in such a way so that the convex outer surface directed forwards, concavity backwards, ramus of both sides, including his two processes, coronoid and condyloid, looking upwards, the mandibular notch looking upwards, and you hold it by your both the hands in this way. So this is the anatomical position of mandible.